So what we're doing today is doing the dressing change for the ring fixation unit or Ilizarov fixation unit. We'll lift up, take the ace wrap off. And see how the ace is wrapped in between the offloading shoes or treads so that the patient doesn't slip later.
Do you need anything for your dressing? You got it already.
Thank you.
Don't leave without talking to me.
All right. And sometimes there's snags, like now, or a pin or a bolt will snag on the dressing. I can discard that. This can be unwrapped or it can be cut off, whichever you prefer.
Pretty much a precision gadget.
Again, wrapped in between the foot and the treads so that it covers the foot from any dirt or debris from floor, but doesn't cover the treads. So this patient is directly post-op, so he will have some gauze around his foot, but after this period there should be little, if no, gauze. Take our scissors. Scissors would probably be better to be a little more sturdy than these. These are kind of flimsy scissors, but they should do the job.
That owl was
Hang on here.
unnecessary owl.
This drain is removed. And we can you see the pin sights with the gauze. We'll remove these and inspect the pin sights for any signs of infection. You'll see some drainage on the dressing. That's normal. This one even has a little bit of a green tint to it. That does happen. See these red rubber stoppers, that they are snugging the dressing up to the skin and reducing the local swelling. You can see the roughness of the gauze. It's a coarse fabric. It's very good at taking away any debris or drainage. Sorry. This one's a tight one, I'm sorry. There you go.
Oh, where's my pipe when I need it?
Okay. Now we're done with that portion.
Oh,
We're done with the removal. All the pin sites do appear to be good. Here's our mixture of chlorhexidine gluconate, or Hibiclens as the brand name is. Put the entire amount in a basin, or you can mix it within the alcohol container. So 4 ounces of this, plus roughly 12 ounces of rubbing alcohol. And we will mix.
you know my trash can.
The dressing cutting is folding over once, folding over twice, and there is a thick folded edge that we will hold like this and cut about 60% of the way across the gauze to make it look like a pair of pants or a long pair of shorts. You take that in your hand, dip it in the solution,
Oh,
and then place around the pin. Snug the pin back and repeat for all the pin sites. You can have these all pre-cut if you wish. And this works well in teams. Sometimes even the patient is able to help this process along by doing the cutting. Remember, at all times, the pins and the pin sites should be touched with gloves only. Bare fingers should not be used. Sometimes if the pin sites are close enough together, you may be able to reach 2 pin sites with 1 folded gauze. But these are just maybe a little too far apart to do that with at the top of this particular fixator. Notice that I'm not wringing these dressings out. They're nice and wet. A little bit drippy as they get put on. That is perfectly fine. Wringing them out too much reduces their ability to kill the bacteria around the pin sites. We got just a few more pin sights to do. What we do not like to see is gauze to be strung out and then wrapped around a pin sight. That tends to put a lot of focal pressure on the skin, causes problems. Folded and snug down is the best way in my patient population to do it. This one may not be wet enough. A little more. And there we go. Especially when these pin sights are fresh, a little bit open. Of course, the alcohol may sting some. They may want to take one of their pain medication pills prior. There gets to be tight spaces. This is one of them. There you go.
Sound effects you hear in the background are from the patient.
Try and last pin sight here. Again, over 50% cut. Take the gauze, slip it over the pin sight, and then snug. Okay, place it back in the alcohol container. You can make fresh next time to throw it away. I do not recommend that, but some fixators with more pin sights will require more mixture than others.
Is this procedure for my benefit?
Yes, it's to protect. It's to prevent infection.
No, I mean, I'm gonna be doing this.
No.
No.
Oh, home nurse. Acrylics gauze or something equivalent goes around the edges to help with the sharp edges of the frame. And for dirt, debris protection at home. So if you notice that the gauze again gets woven through the treads, not over top of the threads. We'll put large ace wraps We'll feed it through these threads, or these treads, excuse me. Just like that, as a good starter. And then lift up. And then around. Now, it's good policy not to put too much pressure on the toes. It gets annoying to the patient after a while. In certain patients, it can cause friction or pressure, irritation of the skin.
Am I helping or
You're doing just perfect.
distracting? You weighted me down. I can't
So,
raise that.
This is the ring fixation dressing technique. Thank you for watching.